Welcome to today's Explainer. We are jumping right into a topic that perfectly blends advanced medical tech with meticulous engineering. We're talking about the architecture of precision, specifically custom implant surgical guides. Now, if you really stop and think about it, the human mouth is an incredibly complex, totally unique landscape. For surgeons navigating this unpredictable terrain, well, guesswork is absolutely not an option. Today, we're going to explore exactly how modern dentistry completely eliminates that guesswork, giving surgeons an unparalleled level of accuracy.
Okay, let's dive into this by defining exactly what it is we're looking at. What actually is a custom implant surgical guide? Simply put, it's a personalized precision tool. But I want you to really focus on the word translates, because this tool literally translates abstract patient data, their unique anatomy and ultimate restorative objectives, into a tangible, physical roadmap. This isn't just some generic ruler or a one-size-fits-all stencil. It's a highly specific bridge between digital data and predictable, flawless implant placement during actual surgery.
Here is our agenda for today's Explainer. 1. The Precision Surgical Roadmap. 2. Mapping patient-specific anatomy. 3. Choosing supports and materials. 4. Configuring the guide sleeves. And 5. Planning for complex cases.
Starting off with Part 1, the Precision Surgical Roadmap. Personalizing the blueprint.
Think of this roadmap as the absolute foundation of everything that follows. Every single patient who walks into a clinic brings a totally unique, fully unpredictable anatomical terrain. Now, the crucial point is how these specific patient variables dictate the roadmap itself. The surgeon isn't just looking at a missing tooth. They are dealing with completely unique underlying anatomy. They have to account for varying bone density, which obviously impacts how an implant holds. They're navigating highly individualized soft tissue contours. And on top of all of that, they've got to perfectly align the surgery with the final restorative objectives, meaning how the tooth will actually look and function once it's all finished. To achieve a predictable outcome, this blueprint requires absolute, total personalization.
Moving right along to Section 2, Mapping Patient-Specific Anatomy, the Digital Foundation.
Before a single physical tool is ever manufactured, technologists have to accurately capture this complex anatomical landscape. And I absolutely love this digital workflow. It's just a brilliant step-by-step process. First up, we have CBCT imaging to look beneath the surface, paired with highly detailed intraoral scans. Then comes Step 3, which is literally the magic moment: registration. By marrying the DICOM data, the 3D bone X-rays, with the STL surface scan data, designers create a perfect virtual clone of the patient's mouth. This rock-solid digital planning workflow lets them evaluate bone contours, identify critical landmarks, spot tricky tissue undercuts, and lock in the prosthetic requirements. All of this before any physical fabrication even begins.
Let's move to and see how this builds in Section 3, choosing supports and materials, the physical foundation.
So we've mapped the terrain digitally, but now we've got to cross over into the physical world. And what's really interesting about this is how entirely different anatomical situations require completely different stabilization strategies to keep the guide perfectly still. If the patient has existing dentition, we use a tooth-supported guide that rests securely on their natural teeth. But what if they have fully edentulous ridges, meaning no teeth at all? Well, then we shift to a tissue-supported guide, anchored firmly via the soft tissue contours. And for cases requiring extensive surgical access, we rely on a bone-supported guide that rests directly on the skeletal structure. The anatomy literally dictates the engineering here.
But it's not just about the shape, it's about the chemistry. Material selection matters tremendously. The operating room is an intense environment. The drills generate serious heat and physical pressure. So to maintain absolute accuracy during these complex or extended drilling protocols, the guide has to be fabricated using high temperature and high rigidity resins. Because think about it, if the material warps even a fraction of a millimeter under pressure, the entire digital plan just falls apart.
Next up is Section 4, Configuring the Guide Sleeves, Microscopic Mechanics.
If the guide is the roadmap, then the sleeves are the steering wheel. Let's look at a crucial comparison here: the pristine digital plan versus the physical osteotomy. The digital plan is theoretical, right? It's mathematically flawless. But the physical osteotomy, the actual bone preparation during surgery, is a demanding, messy reality. The guide sleeves act as the physical gateways for the surgical drill. They're the perfect bridge, ensuring the physical reality exactly matches that digital theory.
To make that bridge work, the settings on these sleeves have to be hyper-specific. Designers determine the exact sleeve length and the offset distance. They calculate the precise angulation required, along with the necessary sleeve-to-sleeve spacing. These custom settings are what determine how accurately the physical osteotomy matches the digital plan. They've got to be customized to accommodate the specific implant systems being used, variations in bone density, and anatomical areas with super-limited surgical access.
Finally, that brings us to Section 5, Planning for Complex Cases, the Ultimate Test. So, we've seen how the technology works for standard procedures, but what happens when we push these tools to their absolute limits? I want to pose this question directly to you. How do custom guides actually adapt to the most extreme and complex surgical scenarios? When the anatomy is highly compromised, how does a simple piece of resin ensure a flawless surgery? Just take a moment to think about that before we reveal the engineering solutions. In practice, these severe scenarios include immediate implant placement, where a tooth is extracted and replaced in the exact same visit, or full arch restorations, which is completely rebuilding a patient's smile, or dealing with severely resorbed bone, where the physical foundation is basically gone. In these extremely delicate, high-stakes situations, standard freehand surgery becomes incredibly difficult and risky. A custom guide isn't just a helpful tool anymore, it becomes an absolute clinical necessity.
To conquer these complex scenarios, the guides rely on some brilliant advanced features. We're talking adaptive designs that shift as the surgery progresses. We see stackable guides where multiple guides actually lock into place sequentially during different phases of the surgery. Dedicated fixation systems, like these tiny pins that lock the guide right into the bone so it cannot possibly move, and all of this is backed by careful quality verification to provide total control and predictability.
And this brings us to a mic drop of a quote that perfectly sums up our final takeaway. Personalized planning transforms surgical guides from positioning templates into precision instruments. We have moved so far beyond a basic plastic template, folks. We are talking about highly calibrated precision instruments. That translation from unique digital data to physical reality is what makes modern implant surgery so predictable and safe. So here is a final thought to leave you with. If we can achieve this level of microscopic digital to physical precision in the human mouth, what complex area of human anatomy will this type of architectural precision transform next? Thanks so much for joining me on this explainer, and I will catch you next time.